Welcome to Fertile Minds. My name is Professor Hayden Homer. I am a CREI accredited fertility specialist with the Queensland Fertility Group. Today I want to speak to you about the chances of having a pregnancy if you are in your 40s. So how does age affect fertility? And this is female age. Female age is the single most important determinant of pregnancy success. And this stems from a number of biological reasons. The first is that the egg contributes virtually everything to the early embryo, which is the early pregnancy. So pregnancy success is rate limited by egg quality. The second point is that women are born with a fixed number of eggs, and that's about 1 to 2 million eggs. They don't get any new eggs throughout their lifetime. So this means that eggs suffer two effects with aging. One is there's a decline in egg number, and the second is a decline in quality. In terms of pregnancy success, it is very much dependent upon egg quality, with egg number being less important for natural fertility. And this is because during natural cycles, only one egg is released. So it doesn't really matter how big the pool of eggs in the ovary is. It really only matters how good that one egg that is ovulated is. The consequence of this, therefore, is that as women get older and egg quality declines, so too do the chances of pregnancy success. So for women in their early 30s, so under 35, about 80% on average will conceive after 12 months of trying, assuming that there's no obvious block to fertility. For women in their 40s, however, the chance of success drops by more than half. So less than 40% of women in their 40s would have conceived after 12 months of trying. Another major impact of declining egg quality with advancing female age is not just the ability to fall pregnant, but it's also to do with risks during pregnancy. So lower quality eggs produce embryos that have a higher chance of having a chromosomal problem, things like Down syndrome. And this can also lead to pregnancy loss, such as miscarriage. So to give you an indication of the impact of age on miscarriage risk, for example, for women under 35, roughly 15% of pregnancies miscarry, whereas for women from 40 to 44, 50 to 80% of pregnancies are at risk of miscarriage. So what if someone in their 40s still wants a baby? The chances of that happening are still reasonably good. It's important to have a systematic assessment of your fertility prospects with a trained fertility specialist, and this would include a number of tests to assess various aspects of your fertility. So in terms of assessing the eggs, there are three components to assessing eggs. One is whether an egg is being released, and that's a test for ovulation. That one is quite simple to do. It can be done with ultrasound monitoring or serial blood tests. The other test for eggs is a test for measuring how many eggs you have, that is, numbers of eggs. And this can be done with either an ultrasound scan to measure the number of something called follicles in the ovary that you can see on ultrasound scan. That's called an antral follicle count, or a blood test known as anti-Müllerian hormone. You may have heard quite a lot about anti-Müllerian hormone, or AMH, in the news. It's sometimes referred to as the egg timer test. It's produced by cells that surround the egg, and these cells are known as follicular cells. And the more eggs there are, the higher your AMH level will be. So it's particularly useful in treatments like IVF, where we're trying to get large numbers of eggs. It's quite irrelevant during natural pregnancy, because during natural pregnancy, you're conceiving with one egg that's ovulated. So it doesn't really matter how big the pool is. It's more important how good that egg is. And an important point that must be stressed is that AMH is not a measure of egg quality. It is more a measure of egg number. The other feature of the egg that we'd love to measure is egg quality. Unfortunately, there is no test for egg quality. Each egg has its own unique property, so that at any given time, a woman will have a range of quality of eggs in the ovary. What changes over time is the proportion of those eggs that are good quality. So to speak about a person having good or poor egg quality is actually a misnomer, because it implies that all eggs have the same quality at any given time, which they don't. So how do you measure egg quality? Well, still the best measure is female age. So the best marker of egg quality is still age. So we know in general that women under 35 years have a high proportion of good eggs. And that changes quite abruptly in the next 2 years leading up to 38. So from 38 years onwards, and particularly relevant to this talk in the 40s, the proportion of good eggs are quite low. So if you look at evidence from IVF, where we look at embryos and the rate of chromosomal problems in embryos, if you extrapolate from this data, it's predicted that roughly 50 to 70% of eggs in women 37 years and older are poor quality. So you can see the shift in proportion of good quality with age. Under 35, good quality proportion is about 80%, and this drops to only about 30% in the 40s, in your 40s. The final assessment in terms of your fertility for women is assessing tubal patency. So that's whether or not the fallopian tubes are open. And these typically involve tests where you put some sort of contrast media through the neck of the womb and into the womb, and track to see whether that media comes out the end of the tube. And there are a number of ways to do this, but the three commonest ones are with X-ray, and that's called hysterosalpingogram or HSG, with ultrasound, and that's referred to as HYCOSY, HYCOSY. And the last one is with laparoscopy, which is keyhole surgery, looking directly at the tubes and then injecting dye, blue dye or methylene blue, to see whether or not the dye spills through the tubes. In modern society, given the knowledge we have about the impact, the irreversible impact of female age on egg quality, one of the rapidly expanding options for women is to freeze eggs when they're young and there are good numbers and good quality of eggs. So egg freezing has grown in popularity quite considerably, and many of the large tech companies in the US, including Facebook, Apple, they all incentivize their female staff. They incentivize their contracts for female staff by offering egg freezing as part of their contract. Egg freezing remains the only way to preserve good quality eggs with aging, because at present there's no way to reverse the quality of improve the quality of bad eggs. No treatment has proven to be fully effective in the clinical setting. So one way around this is to freeze eggs whilst you're young. If, of course, you're in the difficult situation of having eggs that are poor quality, then the next best option is to use eggs donated from someone else, someone younger, known to have good quality of proven fertility. And this is known as egg donation. Egg donation involves an IVF type procedure. So the donor is stimulated with drugs to grow multiple eggs. Those eggs are harvested and then fertilized with your partner's sperm or with an identified sperm donor to create embryos that are then transferred to the older patient. That patient then carries the pregnancy and gives birth and is the legal parent of that child. The typical sort of rule of thumb that's quite popular is that you try for a year, and then if you haven't been successful, then you seek expert help. I'd like to modify that somewhat to say that that is very age dependent. And certainly for women under 36, trying for a year is a reasonable option. It gives you a good opportunity to fall pregnant naturally without requiring any intervention. However, after 36, because the window of opportunity is perhaps narrowing more quickly, it would be worth finding out quite early on if there are any other major blocks to your fertility that would absolutely require treatment. So in this group of women above 36, I recommend seeking assistance earlier, and that is after 6 months of trying. There are also other groups of patients who do not need to wait any particular length of time before they seek assistance, largely because there's a strong indication that something is not quite right. And one obvious group are women who don't have regular periods. So if your periods are quite spaced out, longer than 2 months apart, or even longer than 6 weeks apart, it's very unlikely that you're ovulating. And if you're not releasing an egg, you won't get pregnant. So this should be investigated because treatments to induce ovulation are quite simple and quite effective. The other group of women who may wish to seek treatment sooner rather than later, apart from with a background risk related to age, are those who may have something in their history pointing towards damage to the fallopian tubes. And this would include women who have a history of pelvic infection like chlamydia or gonorrhea, or who are known to have tubal damage before because of a previous ectopic pregnancy, or they've had a laparoscopy that showed a tube is damaged, or quite severe endometriosis. I'd recommend strongly that you plan ahead in terms of pregnancy and you establish a strategy quite early on for how you are going to approach your own individual situation. And for instance, if you don't anticipate having children over a period of time when egg quality undergoes a severe decline, that is in the mid-30s, then you might consider freezing eggs so that you retain good egg quality for when you are ready. Another way to strategize, and this is where IVF can be very, very useful, is to consider how many children in your family you're looking forward to having. And if it's about 2 or 3 children and you already say 36, IVF can help you by freezing surplus embryos. So if you got pregnant in one embryo transfer, by the time you've had your child and are 2 years older, you'd still have embryos that are 2 years younger. So that way you retain your fertility potential and you satisfy your ambition in terms of family size. I hope you found our video helpful. Please leave a comment below and subscribe to our channel to access more videos in the fertility series.